Golfer's elbow, also known as medial epicondylitis, is a condition that affects the tendons on the inside of the elbow. Despite its name, it can occur not only in golfers, but also in individuals who participate in activities that involve repetitive wrist and forearm movements. It is similar to tennis elbow, which affects the tendons on the outside of the elbow. Causes: golfer's elbow is typically caused by repetitive and forceful wrist or finger motions, leading to the overuse and strain of the tendons that connect the forearm muscles to the bony prominence on the inside of the elbow. This can result from activities such as golf, throwing sports, weightlifting, racket sports, carpentry, and repetitive typing or computer use. Symptoms: the most common symptom of golfer's elbow is pain and tenderness on the inside of the elbow. The pain may radiate down the forearm and worsen with specific movements, such as gripping, lifting, or bending the wrist. Other symptoms may include stiffness, weakness, tingling, or numbness in the affected arm or hand. Diagnosis: a healthcare professional, usually an orthopedic specialist, can diagnose golfer's elbow through a physical examination and by reviewing the individual's medical history. Imaging tests such as X-rays or MRI scans are sometimes ordered to rule out other potential causes of elbow pain. Treatment: treatment for golfer's elbow typically involves a combination of non-surgical methods, including rest, avoiding activities that worsen the symptoms and giving the affected arm time to heal; ice therapy, applying ice packs to the affected area to reduce pain and inflammation; pain medication, over-the-counter pain relievers like non-steroidal anti-inflammatory drugs, NSAIDs, may help alleviate pain and reduce inflammation; physical therapy, specific exercises and stretches to improve flexibility and strength in the forearm muscles may be recommended; bracing or splinting, wearing a brace or forearm strap can provide support and relieve stress on the injured tendons; corticosteroid injections, in some cases, a corticosteroid injection may be administered to reduce inflammation and pain; extracorporeal shock wave therapy, ESWT, this treatment uses sound waves to stimulate healing in the affected area; platelet-rich plasma, PRP, therapy, a procedure in which a concentrated solution of the individual's own blood platelets is injected into the affected area to promote healing. Surgery is considered a last resort and is typically only recommended when non-surgical treatments fail to provide relief after an extended period. Recovery: recovery time for golfer's elbow varies depending on the severity of the condition and the individual's adherence to treatment. With proper rest, conservative measures, ND rehabilitation, most people can recover within a few months. It's important to gradually return to activities and avoid overuse to prevent a recurrence of symptoms. Prevention: to help prevent golfer's elbow, it's important to use proper equipment and technique in sports and activities involving repetitive forearm movements. Warm up adequately before engaging in physical activities. Avoid gripping objects too tightly or for extended periods. Take frequent breaks during repetitive tasks to rest the forearm muscles. Maintain overall physical fitness and strength. If you suspect you have golfer's elbow or are experiencing persistent elbow pain, it is advisable to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. Here are some interesting facts about golfer's elbow. Misleading name: despite its name, golfer's elbow is not exclusive to golfers. It can affect anyone who engages in activities that involve repetitive wrist and forearm movements, such as tennis players, carpenters, weightlifters, and even individuals who frequently use computers or perform manual labor. Similar to tennis elbow, golfer's elbow is similar to tennis elbow, also known as lateral epicondylitis. Both conditions involve inflammation and pain in the tendons, but they affect different sides of the elbow. Golfer's elbow affects the tendons on the inside of the elbow, while tennis elbow affects the tendons on the outside. Common symptoms. The primary symptom of golfer's elbow is pain and tenderness on the inside of the elbow, which can radiate down the forearm. Other symptoms may include weakness, stiffness, tingling, or numbness in the affected arm or hand. Overuse and strain. Golfer's elbow is typically caused by repetitive and forceful wrist or finger motions that lead to the overuse and strain of the tendons. These motions put stress on the tendons and can result in tiny tears and inflammation, not just tendinitis. While golfer's elbow is often referred to as tendinitis, inflammation of the tendons. Studies have shown that the condition may involve more than just inflammation. It can also involve degenerative changes in the tendons and microscopic tears. Treatment options. Non-surgical treatment options are usually effective for golfer's elbow. These may include rest, ice therapy, pain medication, physical therapy, bracing, corticosteroid injections, shock wave therapy, and platelet-rich plasma therapy. Surgery is only considered if conservative measures fail to provide relief. Healing time. The recovery time for golfer's elbow varies depending on the severity of the condition and individual factors, with proper treatment and adherence to recommendations. Most people can recover within a few months. However, it's important to note that individual healing times may vary. Prevention is key. Taking preventive measures can help reduce the risk of developing golfer's elbow. This includes using proper technique and equipment during physical activities, warming up adequately, avoiding prolonged gripping, taking breaks during repetitive tasks, and maintaining overall physical fitness and strength. Remember, if you suspect you have golfer's elbow or are experiencing persistent elbow pain, it is always best to consult with a healthcare professional for an accurate diagnosis and appropriate treatment.